Mosquito-borne disease. What are they? Mosquito-borne diseases are those that are spread through the bite of a mosquito carrying the infection. The most common type of mosquito that carries these diseases is called the Aedes aegypti mosquito. There are many different types of mosquito-borne diseases, including Zika virus, West Nile virus, chikungunya virus, dengue, malaria, and yellow fever. In this video, we will talk more in depth about 3 of these diseases. According to the World Mosquito Program, nearly 700 million people contract mosquito-borne illnesses each year, causing more than 1 million deaths. One of these mosquito-borne diseases is the Zika virus. Most people who contract the Zika virus do not display symptoms. Of those that do, the symptoms usually last between 2 and 7 days. Symptoms of Zika include a fever, rash, conjunctivitis or pink eye, headaches, and muscle and joint aches. There has been an association found between having Zika while pregnant and the infant developing microcephaly and Guillain-Barré syndrome. The arrow here is pointing to an example of microcephaly in a baby. The baby on the left was born with microcephaly, meaning that their head is significantly smaller than expected. According to the CDC, West Nile virus is the leading cause of mosquito-borne diseases in the continental United States. West Nile virus is another mosquito-borne disease that does not cause symptoms for many of the people it infects. People in the United States are most likely to contract it during mosquito season, which starts in the summer and continues into the fall. In those who are infected, only 1 in 5 people actually develop symptoms. These include headache, body aches, joint pains, vomiting, diarrhea, and a rash. Of those that are infected, 1 in 150 will develop more serious symptoms. These include neck stiffness, stupor, disorientation, coma, tremors, convulsions, vision loss, numbness, and paralysis. These symptoms are severe and sometimes even lethal and will require hospitalization. While anyone can develop these serious symptoms, those over 60 years of age and those with certain pre-existing health conditions are more at risk. According to the World Mosquito Program, there has been a 30-fold increase in global incidence of dengue over the past 50 years. Dengue is the 3rd mosquito-borne disease that will be discussed in this video. It is caused by a virus. A previous infection of dengue makes one more likely to develop severe illness if they are infected again. Symptoms of dengue include a high fever, headache, vomiting, joint pain, and rash. On the right is a picture of what a rash caused by dengue looks like. These symptoms can last from 2 to up to 7 days. People infected with the dengue virus can go on to develop dengue hemorrhagic fever and severe dengue, which is a more acute form of the disease. These are serious and can lead to death. Mosquito-borne diseases are often thought of as a problem in places like South America and Africa, but they do exist in the United States, including Philadelphia. This year, 2021, the Philadelphia Department of Public Health reported 2 cases of West Nile virus in the city. There is an increased risk of more people contracting mosquito-borne diseases until the first frost, which kills many mosquitoes. The Department of Public Health also continues to report mosquito pools positive for mosquito-borne diseases. The CDC says when infected adult mosquitoes are spreading germs to people, acting quickly can stop further spread and prevent people from getting sick. There are many different ways you can prevent mosquito-borne diseases. Wearing insect repellent while outside is one way to prevent these diseases. Insect repellent with DEET, picaridin, or oil of lemon eucalyptus are the most effective at deterring mosquitoes. Another important part of mosquito-borne disease prevention is to check and remove standing water. The picture on the right shows some places around a home that are perfect for mosquitoes and their larvae. You can do this once a week or after a rainstorm when you know there are a lot of areas of standing water. Another part of removing standing water is checking any tree holes and filling them up. That way mosquitoes cannot lay their eggs. Keeping screens on windows and doors will help prevent these diseases because they will keep mosquitoes from getting inside your home, thus keeping you safe from getting bit. Using larvicide and adulticide are other ways to prevent mosquito-borne diseases. Larvicide can be used to treat bodies of water that will not be used for drinking and cannot be covered or dumped out. Adulticide can be used to kill adult mosquitoes in areas that are dark and humid where mosquitoes like to rest. The overall control of mosquitoes relies heavily on reducing the amount of standing water because this is where mosquitoes reproduce. Wearing protective clothing and using the other methods listed are a great way to protect yourself and your family from contracting mosquito-borne diseases. If you would like to learn more about mosquito-borne diseases, you can visit the websites of the CDC and the World Mosquito Program. They will be linked in the description as well. Thank you for watching.